Introduction: Understanding safe sex. Safe sex is one of the most important aspects of maintaining physical and emotional health in relationships. It not only protects against unplanned pregnancy, but also reduces the risk of sexually transmitted infections. Many people underestimate the importance of education when it comes to sex, but knowledge can truly empower individuals and couples. Understanding how to engage in safe sex allows partners to enjoy intimacy without unnecessary stress or fear. Safe sex also builds trust between partners because it shows responsibility and respect for each other's health. What is safe sex? Safe sex means engaging in sexual activities in a way that lowers the risk of unplanned pregnancy and protects against infections. It does not mean avoiding intimacy, but rather making informed decisions and using protective methods. The most common practice associated with safe sex is the use of condoms, but there are also other important aspects to consider. Safe sex involves both physical protection and open communication between partners. Emotional safety is just as important as physical safety in any intimate relationship. Why safe sex matters: unprotected sex can lead to unplanned pregnancies, which may cause emotional, financial, and social challenges. It can also increase the risk of contracting sexually transmitted infections such as HIV, chlamydia, gonorrhea, and syphilis. These infections may cause long-term health problems if not diagnosed and treated properly. Using safe sex practices is therefore essential for both personal well-being and the well-being of one's partner. It also promotes a healthier society because it helps reduce the spread of infections and prevents unwanted pregnancies. The role of education: one of the strongest tools for safe sex is education. When people learn about their bodies, contraception, and health risks, they are better able to make wise decisions. Sex education should not only be about biology, but also about emotions, respect, and relationships. By removing stigma and promoting open discussions, communities can make safe sex knowledge accessible to everyone. This ensures that individuals do not have to rely on myths or peer pressure when making intimate choices. Pregnancy control basics are common safe practices. One of the main goals of safe sex is to prevent unplanned pregnancy while allowing couples to enjoy intimacy. There are many ways to control pregnancy, ranging from barrier methods to hormonal methods and natural approaches. The simplest and most accessible method is the condom, which also protects against sexually transmitted infections. Condoms are available for both men and women. Though male condoms are more commonly used, using a condom correctly every time is highly effective in reducing pregnancy risk. Hormonal methods: another popular way to control pregnancy is through hormonal methods such as birth control pills, patches, or injections. These methods work by regulating hormones to stop ovulation and make it harder for sperm to reach the egg. They are very effective when used consistently, but require medical guidance and prescription. One of the biggest advantages is that hormonal methods are convenient and allow couples to plan intimacy more freely. However, they do not protect against sexually transmitted infections, so sometimes they are used together with condoms. Intrauterine devices, IUDs. Another option is an intrauterine device. Commonly known as an IUD, this small device is placed inside the uterus by a healthcare provider and can last for years. There are hormonal IUs and non-hormonal copper IUDs, both highly effective in preventing pregnancy. Safe sex practices beyond contraception.